You can now use a positive rapid test to get an official COVID diagnosis from a doctor. The policy rolled out to the general public on Thursday, after a trial run among select demographics.
On the first day of the expanded policy, physicians reported a surge of bookings from people needing a diagnosis. They also reported a range of technical and logistical difficulties that made each session longer than an in-person consult.
The physician checks the rapid test for 2 lines. Then she tells the patient via video conference that a diagnosis has been made. Starting Thursday, any individual can use a positive rapid test for a COVID diagnosis. All morning, this doctor was kept busy with virtual consults. She ran into her fair share of snags. Precious time is lost as patients collect documents and fill in missing data. When the internet connection is bad, it's all made worse. To complete the session, the doctor has to switch to the phone. She says she now does twice as many virtual consults as before. Each one takes at least 15 minutes, which is more than twice as long as her in-person consults. Even when her waiting room is empty, there are always patients waiting online, keeping her on her toes.
I've seen quite a few people who are already in a state of discomfort. They've already tested positive on a rapid test, and they waited until today so that they could do this video conference. I've seen it all. Please stand farther away from the camera because I need to see your entire body in the frame.
She says many patients received a positive rapid test days ago. To avoid a PCR test, they had waited until Thursday so that they could be diagnosed over video conference. They can also choose to appoint a proxy who takes the rapid test to a doctor for diagnosis. Another option is to travel by car or by foot to the clinic themselves, but doctors don't encourage this approach.
If they come here with 2 lines on a rapid test, we rush to fasten our masks properly. We deal with their issue and then try to get them out. Even when they send an uninfected family member as a proxy, there's a potential risk because that person could still be a carrier.
On the first day of the rapid test diagnosis policy, CECC advisor Li Bingying said that a false negative could do more harm than a false positive. Individuals who test negative should still get a PCR test to confirm if they're experiencing COVID symptoms.